final paper is entitled Single Port.
Placement of a gastric pacemaker, laparoscopic for children. I tried to modify my technique a little bit so that I can reduce the number of ports and also reduce the time for this operation. I've done 4 cases using this technique. I use umbilical port and then put a 5mm step trocar. Under visualization, inside and outside, then I mark my incision for the pacemaker, as you can see over here. Once I have marked my incision, then I go deeper, split the muscle a little bit. And once I split, I'm able to put another port through this same incision. Once I put the port in, then I am able to measure the distance from the pylorus to about 10 centimeters. And then I place my electrodes by pulling out the stomach through this small wound in there. Once the electrodes are placed this way, we can place it very well with the hand suturing, and the stomach is then reduced back into the peritoneal cavity. After that, the pacemaker is placed in this area. During the entire procedure, I watch the procedure with the gastroscope to make sure that the needles of the electrodes do not breach the mucosa. The results of procedure, there are no early or delayed complications. There were 3 patients with complete response. They became asymptomatic, but 2 of them needed fundoplication to prevent excessive vomiting. 1 patient had a partial response. 1 of the 3 patients remained asymptomatic after switching off the stimulator for 3 months, and his stimulator was removed. At present, he is doing well. Presently, there are 2 patients who have complete response. 1 patient had a partial response. On conclusion, it's a safe and feasible and easy technique with a reduced number of ports, and it's possible to safely perform this procedure with 1 incision instead of the traditionally described 3 incisions. Thank you very much.
We have time for 1 comment or question. One question I would have is, if you have to go back and perform a fundoplication, are you able to work around the leads, or do you need to disconnect them and then reinsert them?
No, we are able to easily work around the leads, and the fundoplications that I did afterwards, I didn't touch the leads. I was able to bypass and go around it.
Thank you. I'd like to thank all of the presenters during the session. I think it was an interesting and innovative approach presented by all. Thank you.